the bulk of getting ready for transition happens in pediatrics. And so I think that you have to start early. So you have to start at age 13. I mean, that 12 to 13 is the recommended age that you should start talking about, well, do you know that at some point you're going to move to the adult world? And having the patients in the family know this and understand this and start to become prepared for it. Um, the next aspect is that you need to continue to set goals for what you want them to know. And again, I can use got transition, but I've actually kind of um, made it a little bit digestible for myself as well as my staff. So I've kind of put out there uh, these modules that are called who, what, where, and why. And so at age 12 to 14, the first part is just who you are with the disease. So it doesn't matter what chronic disease you have, be it beta thal, sickle cell, know who you are. So do you know what your diagnosis is? Do you know how you inherited it? Do you know what the basic pathophysiology is? Why you have issues? So just knowing the basics, and it's not that hard to know, but I think that gives some definition to who they are as a person with that disease. And it gives them a little bit of independence in thinking that they can recite this and say, this is me, this is why I come see the doctor. And it's just a part of who they are. Then I go into what. And so from the who I go to the what. That's 15 to 16. That's when they're starting high school. They start to need to answer these questions very independently. They need to know. So they need to know what to do in different situations. So what would they do if they had a fever? What is a fever? What phone number would you call if you had a problem? What medications are you on, and what's the dosage? So the what is a lot. What are the complications that you can have? And so I definitely think that the what trickles over into adulthood eventually, because there's a lot. But 17 to 18, I definitely start, even if they don't have all the what down, the 17 to 18, I start the where and the why. So where are you going to go from here? So where logistically, like what provider, adult provider? So if they're going to, where are you going to go to school and college? Where are you going to go to work? Where are you going to have insurance? Even though I'm not a primary care doctor, I do go into the where you can get into trouble. So that's the drug, sex, and alcohol discussion, right? And then the why, like, why am I, going through all this? Why do we have to make sure that this happens before you go somewhere? And so I go through all this kind of these modules, and I try to make sure I go through all of those before we have them transfer to an adult provider. And what I would pass on is then, as you're in that 17 to 18, spend more than just that last year finding who this person is going to go to. So you're kind of solidifying, patients many times don't know until they graduate, or, know for sure when they're 18 where they're going to go, because they don't know if they have a job somewhere or if they're going to move. But start to kind of feel out, if they're going to stay locally, I already have this person you can go to, and start communicating. There's a lot of literature to support that the more overlap you have between pediatrics and adults, the better you do. And St. Jude's had published that too. So we have a touch point. Even when patients go to adults, we have a touch point. So we tell our patients, you're going to go to the adults, but my social worker on pediatrics is going to reach out to you soon, to make sure that everything transitioned well. And then vice versa, patients who are on the adult side will come meet the pediatric patients early. So even before they move over, I want my adult team to come to the pediatric clinic so they can see them and meet them. And so it's not just a fresh, meeting on the adult side. So those are some of the strategies I probably would definitely pass on.